Hello viewers, welcome to another vlog. I am Dr. Joydev and welcome to my YouTube channel. Today I'll talk about one anti-hypertensive drug and its side effects. So the today's drug is amlodipine. Now amlodipine and many of you already know that amlodipine is a type of anti-hypertensive medication. It is such a medication which helps to reduce the hypertension, and this medicine is usually prescribed for a longer duration. So whenever you are taking this medication for a longer duration, it is sometimes it is seen that some of the patients experience some kind of side effects. In this vlog today I'll be discussing about the side effects of amlodipine. So first we have to know the mechanism of action of amlodipine. Amlodipine is a type of calcium channel blocker, and it is specially it blocks the L type of calcium channel which is present on the surface of muscle cells, and it helps to cut down the entry of calcium into the cell. So it is a type of calcium channel blocker, and by reducing the entry of calcium into the cells, it actually helps to relax the muscles in the wall of blood vessels. So if the muscles in the wall of blood vessels are not contracted and they remains in a relaxed state, then the internal diameter of the blood vessels are actually increased, and that reduces the blood pressure. So this is the mechanism of action of amlodipine. Now let's understand the functions of amlodipine, as because it is a type of antihypertensive medications, so it helps to reduce hypertension. And as we know that uncontrolled hypertension for longer duration can precipitate any cardiac events like acute myocardial infarction or cardiovascular accidents like stroke. So by reducing the pressure, by reducing the blood pressure, it actually reduces the incidence of cardiac complications and stroke. It also reduces the incidence of angina. What does it mean? Angina is the type of chest pain when there is a depletion of blood supply to the muscles of heart or myocardium. As because we know that the vessels which supply blood to the myocardial fibers, if those vessels are narrowed, or if there is any kind of spasm to these vessels, so there is a reduced supply of oxygen to the myocardial tissue. That means there is occurrence of pain, and this pain is known as angina. Now by reducing those spasms, by increasing the blood supply, amlodipine actually increases the blood supply to the heart and reduces anginal chest pain. So it is helpful in so many ways. Now let's have a look at the side effects of amlodipine. Now the most common side effect of amlodipine is edema. Edema means there is swelling of extremities, and the edema that is often seen in case of amlodipine use, that is usually seen around the ankles. So this is one of the commonest side effect of amlodipine. This is seen in almost 10% of patients who are taking amlodipine, and this symptom or this feature is dose dependent. That means if we increase the dose, the amount of edema will increase, and if you reduce the dose, the amount of edema that will also decrease simultaneously. Now the next common side effect is headache. It is commonly seen in 7% of patients, and this type of headache is actually tension headache type. That means there is an area of pain around the forehead in a band-like structure, and this type of headache is also temporary. That means usually we face this type of headache whenever we are starting therapy with amlodipine, and this type of headache usually reduces, or this type of headache that decreases with the continuous use of amlodipine. Now the next common side effect, that is fatigue. It is usually seen in 4 to 5% of cases, and along with fatigue there is drowsiness to some extent in some patients. Also, amlodipine can sometimes precipitate palpitations. That means there is awareness of the beating heart. So it is usually seen in 4 to 5% cases. It is also dose dependent phenomena. Now the next common side effect, that is nausea. It is usually seen in 3% of cases, and it is sometimes associated with the abdominal pain. Now the next most common side effect is flushing. Flushing means there is redness of the skin in head and neck area, and this symptom, it usually improves within a few days of using amlodipine. Now the next common side effect is rash. Rash is usually petechial in nature. That means there is appearance of reddish dots or bluish or violet color dots in the skin, and this is known as the petechial rash. This can also occur in case of continued amlodipine use. There may be presence of myalgia or hypotension. Hypotension, it is characteristically seen whenever we are taking amlodipine along with some other macrolide antibiotics. It is commonly associated with the use of macrolide antibiotics, so the dose has to be monitored cautiously. Next common side effect is dizziness. It is also seen in the initial phase, and this type of dizziness is commonly seen whenever someone is taking amlodipine, and his sudden change of posture, this dizziness, this type of dizziness is usually precipitated. So to prevent this, we have to stand slowly, or if we are changing our posture, then we should change our posture slowly. The next side effect, that is erectile dysfunction. That is one kind of sexual dysfunction. It is very less. It is seen in almost 1% of cases. So this is today's class. If you are new to this channel, then don't forget to subscribe, and don't forget to press the all notification button. If you like this video, then don't forget to hit the like button, and if you have any suggestion to me, then don't hesitate to comment in the comment section below. Till then, take care and stay fit, be healthy. Thank you.